Good morning, everyone. Welcome back to our Wednesday Wellness webinar. For today's topic, we have cervical cancer. All women are at risk for having cervical cancer. For our discussion outline, we're going to tackle the overview, causes and risk factors, the signs and symptoms of cervical cancer, diagnosis, treatment, and how it is being prevented. So cervical cancer, this is a type of cancer that occurs in the cells of the cervix, the lower part of the uterus that connects to the vagina. So as you can see in the picture, this is the cervix and this is the cervical cancer that is already developing. Cancer, this is a disease in which the cells in the body grow out of control. So dumadami siya or nagmutate. Cancer is always named for the part of the body where it starts. For example, nag-start siya sa cervix, so tinatawag siya na cervical cancer. Kung nag-start siya sa colon, tinatawag naman siya na colon cancer. Cancer starts sa breast, it is called breast cancer. So what are the causes of this? It is caused by a HPV or human papillomavirus. So cervical cancer, it begins when the healthy cells in the cervix develop or changes or nagmutate siya in their DNA. A cell's DNA contains the instruction that tell a cell what to do. Most cervical cancer cases are caused by the sexually transmitted human papillomavirus or the HPV. This is the same virus that causes the genital warts. Also, different types of HPV can cause skin warts, genital warts, and other skin disorders. So how it is being spread? Having vaginal, anal, or oral sex with someone who has the virus. So it can even pass kung ang infected person has no signs and symptoms. So what are the risk factors of cervical cancer? Many sexual partners, so pag marami kang sexual partners, higher ang chance mo of acquiring the HPV. Then early sexual activity. Sex at early age increases risk of HPV. Then, STI or other sexually transmitted infections like chlamydia, gonorrhea, syphilis, and HIV or AIDS increases risk factor. Also, may tinatawag din tayo na weakened immune system. So, madali kang magkaka-cervical cancer if mababa ang iyong immune system at meron ka ng HPV. Also, smoking, associated with squamous cell cervical cancer. So what are the signs and symptoms of this? So basta cancer, it is always associated with pain. Kahit anong types of cancer siya. So there is a pain when you have sex. Then unusual vaginal bleeding. So after intercourse, nagkakaroon ng vaginal bleeding. Then nagkakaroon ng unusual vaginal discharge. So meron siyang watery, bloody discharge, or foul odor. So after it has spread, the cancer can cause pelvic pain. Nagkakaroon ng nahihirapan umihi. Then nagkakaroon ng edema or swollen legs. Then nagkakaroon din ng kidney failure, bone pain, weight loss and lack of appetite. So very common ito sa mga cancer patients na payat at saka walang ganang kumain, and then fatigue. So these are the diagnoses for cervical cancer. So we have first screening. So it helps detect cervical cancer and precancerous cells that may be one day develop into cervical cancer. So we have two types for this. So we have pap test or sa Philippines, tinatawag natin ito na pap smear. So yung doctor will scrape or brush cells galing dun sa cervix which are examined sa laboratory for any abnormalities. We also have HPV DNA test. So this involves testing of cells collected galing sa cervix for infection. So another one is we have biopsy. If cancer is already suspected, the doctor will start a thorough examination of the cervix. So gumagamit ang doctor na tinatawag natin na colposcope. Ito yung instrument para ma-check ang abnormalities doon sa cells. So after the biopsy, doon natin malalaman kung ang specimen na nakuha sa loob is malignant or benign. So we have a punch biopsy. Ginagamit ang sharp tool to pinch off the small samples of cervical tissue sa loob. We also do have the cervical curettage. So ginagamit yung curette na maliit na spoon-shaped instrument para kumuha ng tissue sample sa cervix. We also have other tests. So if yung biopsy result is kakaiba, so ang doktor gagawa ulit ito ng test. So gumagamit sila ng electrical wire loop. Gumagamit ng manipis or low voltage wire para makakuha ng tissue sample. So, patient nito is under local anesthesia. So, pwede ang procedure gagawin sa clinic lang. We also have the cone biopsy or conization. So, the doctor will obtain deep layers of cervical cells for lab testing. In here, this procedure is being done sa hospital and yung patient is pinapatulog na or under general anesthesia. So lastly, we have also staging. So the patient has cancer already. So the stage of cancer is the key factor for the treatment. We have the imaging test. So we have X-ray, CT scan, MRI, or what we call PET. It is a positron emission tomography. So para malaman kung kumalat na ang cancer sa cervix. We also have the visual examination of bladder and rectum. So gagamit ang doctor ng instrument para makita yung loob ng bladder and rectum. We also have different kinds of treatment for cervical cancer. We have first a surgery. So sa surgery, this is very beneficial if done at an early stage. So early detection of cancer, mas okay gamitin sa surgery. So we have surgery to cut cancer only. So ipuputulin lang yung shape piece ng cervical tissue pero intact pa rin ang cervix. Then we also have the surgery to remove the cervix or what we call trachelectomy. So tinatanggal ang cervix at surrounding tissue nito. We also have surgery to remove the cervix and the uterus, or this is what we call a hysterectomy into medical term. So it is a removal of cervix, uterus, part of the vagina, and the nearby lymph nodes. Also, we have radiation, treatment to kill the cancer cells. So combination ito ng chemotherapy as the primary treatment. So we have chemotherapy. So itong treatment na to is pinapadaan siya through IV line or dextrose or tablet or both methods are being used. We also have immunotherapy, so drug treatment that helps immune system to fight cancer. We also have a supportive or palliative care. So it is a specialized medical care that focuses on providing relief from pain and other symptoms of a serious illness. So how it is being prevented. So we have to ask your doctor about the HPV vaccine. So vaccine reduce the risk of cervical cancer. So you have also to have a routine pap test or pap smear. So this can detect precancerous condition of the cervix. So for those women who are ages 21 to 30 years old, it is done every 3 years. For those who are 30 to 65 years old, it is done every 3 years or 5 years. Then for the 65 older, no testing needed. So of course, don't smoke and practice safe sex. So you have to use condom and as much as possible, you have to limit number of sexual partner. That ends my presentation for today. Thank you for listening and have a great day. Bye!